Welcome to Technical Seminar Presentation. I am Dhanushri N from Electronics and Communication Department, and today I will be presenting on the topic Artificial Intelligence-based Teleophthalmology application for diagnosis of diabetic retinopathy. Before we jump into the topic, let's understand what is artificial intelligence and teleophthalmology. Artificial intelligence is nothing but a mimic of human brain in which it helps us in decision making and problem solving, whereas teleophthalmology is integration of electronic information and medical technology to digital medical equipment. In other words, it helps the people who live in rural places to contact with ophthalmologists to overcome the barrier of distance and time. Now, these are the topics I'll be explaining in the further slides, which includes introduction, objectives, methodology, block diagram, result and discussions, conclusions, and references. Introduction. The use of artificial intelligence-based health technologies holds the potential to improve healthcare services and medical emergencies. Although AI holds tremendous promise for improving diabetic retinopathy treatment, diabetic retinopathy is a health condition that affects eyes and it occurs by damage to the blood vessels of the light-sensitive tissue at the back of eye, that is retina. One existing application of AI is telemedicine in teleophthalmology, which is the use of technology to remotely diagnose and manage eye disease. By combining AI with teleophthalmology, healthcare providers can improve the efficiency and accuracy of eye disease diagnosis and treatment. Teleophthalmology allows eye exams to be conducted remotely, with the patients using a smartphone or other mobile devices to transmit images of their eyes to an ophthalmologist or optometrist. AI algorithms can then analyze these images to identify any signs of eye disease, such as diabetic retinopathy or age-related macular degeneration. AI-based teleophthalmology can improve patients' outcome by enabling earlier detection and treatment of diseases. This is particularly important for conditions like diabetic retinopathy, which can lead to blindness if left untreated. By detecting these conditions early, healthcare providers can intervene with appropriate treatments and prevent vision loss. Now, these are the objectives of the topic. So, the first one is to understand the AI algorithms and to predict DR in early stage. The use of mobile-based AI algorithm that has high sensitivity for the diagnosis of referable diabetic retinopathy and to improve access to care for patients with diabetics who live in remote areas or have limited access to healthcare facilities, to promote mHealth and timely treatment for diabetic retinopathy by clinicians. Now, this is the methodology. And first comes the scope of the methodology. That is, the application will focus on diabetic retinopathy screening and diagnosis using retinal images captured using fundus camera, whereas fundus camera is mainly built to capture the images of eye, which is to treat DR, that is diabetic retinopathy. The application will be designed to be user-friendly for both patients and healthcare providers, that is doctors. Data collections. Retinal images will be collected from the diabetic patients using fundus camera. These images will be used to train and test the artificial intelligence algorithms used in application. Now, then comes methodology. The application will use machine learning algorithm to analyze retinal images for signs of diabetic retinopathy. The application will use a deep learning model to classify the severity of the diabetic retinopathy. Now, the evaluation. The performance of the application will be evaluated using matrices such as accuracy, sensitivity, specificity, and positive predictive value. Ethics and privacy. The application will aim on protecting the ethics and privacy to maintain patients' privacy and data security. The application will also protect ethical principles such as informed consent and non-discrimination. Now, this is the block diagram to achieve our main goal of the topic, which contains the first one is images, that is data acquisition, where we collect the data or the images through fundus camera and fundus images. Now, next is pre-processing, that is cleaning of data. Feature extraction. We set the target role for the application, that is if person is suffering from DR or no DR. And this features contains precision, specificity, and sensitivity. And then comes artificial intelligence, wherein we use machine learning algorithms to perform the function to achieve our goal or objectives. And then mobile application, where we use mobile app for determining if person is suffering from DR or no. And these are the conditions of the DR. So in figure 2, as we can see, effect of diabetic on normal vision and a person who is suffering from DR, whereas A shows a normal vision where a person is not suffering from DR, and B shows a person who is suffering from DR. So the A picture indicates a clear image where there is no obstacles or nothing, and B is not the same as A. So this is the difference between a person suffering from a DR and not a DR. And the figure 3 shows the different levels of DR. That is, A is who is not suffering from diabetic retinopathy, whereas B, C, D, E shows the different levels of DR, where it gets darker and darker, like in B, C, D, and E. The eye image is getting darker and darker. This shows the stages of DR. And E is the worst case, where it can lead to blindness. Execution of mobile application. Step 1. Install the application and activate all the permission. Step 2. After installing the application, then opening it and splash screen appears and authentication is required, wherein the user has to give password and username for the application. After setting the correct password and login, in a few seconds the menu screen will appear. In this menu screen, there will be headings like such as diabetic retinopathy, where it brief about or has information about diabetic retinopathy, and it has list of patients and doctor whom they want to contact. Step 4. In the menu screen, when we click on the first item, it shows, in step 5, it takes us to next step, that is step 5. By clicking on the patient list, the user will have to complete the list and all the data will be sent to the internal SQLite database that does not require servers or any internet connection. So this improves access to care for patients with diabetics who live in remote areas, have limited access to healthcare facility, and this is user friendly. Step 6. An automatic filling of the database, which then will be viewed so that contacts can be made either for our patients or for our treating ophthalmologist. And step 7. This is the most important part where we will do background image test of for a patient. So step 5, 6, and 7 concludes that the images will be taken in fundus camera, and this will be selected by the patients, and they will send these images to ophthalmologist through internet, which requires which doesn't require any data or any connections. So this will be sent to the ophthalmologist, and the background test will be done in of the patient X through ophthalmologist, where he has a detailed explanation about the stages a person is suffering from DR or no. So step 8, sending the mail to the desired ophthalmologist for different servers. It can be Yahoo, Gmail, or anything. And step 9, perform several tests on our patients with even dark eyes. So this step 9 concludes that the ophthalmologist will perform certain function and he will get in the contact with patients, and they will let them know what are the precautions to be taken or what he or she is suffering from. Results and discussions. We developed an AI smart teleophthalmology application for diagnosis of diabetic retinopathy. The application is Android based and could be used to facilitate the early detection and screening of diabetic retinopathy. It facilitates health and more effective treatment and management of diabetic retinopathy. Physicians and patients can leverage on the various features of application to interact better and also exchange smart medical data. The application can be used to carry out diagnosis via TensorFlow, deep learning, and results can be sent in the patients via email by the physicians or hospitals. The data generated from the application can be helpful for curbing the rising causes of eye-related diseases. So this shows the comparison of the results between Kaggle database and the application of diabetic vision. The Kaggle database is nothing but the open source where we get the data of the diabetic retinopathy, and table 2 shows the results wherein our features are indicated, that is precision, specificity, and sensitivity, and accuracy is also indicated in next to the features itself. So conclusion, the presented AI-based smart teleophthalmology application for diagnosis of diabetic retinopathy is an Android application that facilitates early detection and screening of diabetic retinopathy. It supports smart healthcare and promote diagnosis and treatment of diabetic retinopathy. Telemedicine aims to partially mitigate medical deserts to improve the efficiency of care. Therefore, the examination of DR is currently a real big problem. Our work is a part of the diagnostic assistance for the analysis of background images using telemedicine tools and techniques. In addition, improving the quality of patients' care with the increase in the number of people with diabetics is being reviewed annually. Now, these are the papers I have referred for this seminar topic. So here I conclude with my topic. Thank you one and all. I hope this session was informative. And once again, thank you and have a nice day.